The Cabrini Asylum Seeker and Refugee Health Hub was officially opened on the 28th of April in 2016. At a blessing conducted by Monsignor Ireland, Cabrini Chief Executive Dr Michael Walsh welcomed the then Mayor of Moreland, Samantha Ratnam, and Cabrini's Superior General, Sister Barbara Staley. As head of the Missionary Sisters of the Sacred Heart of Jesus Worldwide, Sister Barbara spoke generally about the plight of asylum seekers and refugees in the world today.
None of our lands are paradise, and so people aren't looking for paradise, they're looking to save their own lives. And are we brother and sister enough to say, come? Does our faith mean more to us than what our nationality means?
She spoke of the specific needs of asylum seekers in the northern suburbs who have no access to work rights, Medicare, Centrelink income, housing or healthcare. For them, this new service is truly a godsend.
In conclusion, I say I love this visible sign, this visible invitation, and this visible call to us to welcome the stranger.
The Cabrini Asylum Seeker and Refugee Health Hub provides a one-stop shop that attends to the physical, spiritual, mental and social health needs of some of Melbourne's most marginalised people, with services including case management and referrals.
There are many asylum seekers released in our community today with no access to health care, and this is the primary group of people that we really want to serve.
With a mix of employed and pro bono staff, Cabrini's Health Hub works in partnership with the Lentara Asylum Seeker Housing Project, St Vincent's Public Hospital, Melbourne, and a range of local agencies, including the Australian Red Cross and the Asylum Seeker Resource Centre.
So those agencies provide support to asylum seekers in the terms of case management and housing support. So to have a health service here on site, co-located with so many agencies around us, those agencies have really welcomed easy access for the people that we're working with, asylum seekers and refugees.
The Cabrini Asylum Seeker and Refugee Health Hub is a nurse-led clinic staffed every weekday.
This service is needed because there is both a geographical and a systemic gap in the provision of services regarding the mental health of people seeking asylum.
In its first 12 months, the Cabrini Health Hub has treated over 130 clients who come from countries all over the world. Ethiopia, Iran, Iraq, Saudi Arabia and Sudan are just some of those countries.
Our state is, as we know, home to over 10,000 asylum seekers on bridging visas awaiting determination of their refugee status. As these asylum seekers have their claims assessed, they are disproportionately vulnerable to a range of mental health challenges. I want to thank Cabrini and the partners for not just being the opportunity to be here today, but for the work that you've all brought in making sure that this continuing fundamentally decent moral response to that major political and social issue of our time is played out here in the heart of Brunswick.
The Cabrini Asylum Seeker and Refugee Health Hub gives priority access to asylum seekers who do not have a Medicare card or rights to work in Australia.
We've already found the benefit and felt the benefit of this facility in this centre. Some of the more complex and difficult cases requiring psychiatric intervention that's not easily available or found, we've been able to refer to the centre here, and they're being picked up in a way and supported that we are phenomenally grateful for, and is precisely what people require. So we're already seeing the very tangible benefits of putting a facility like this in place.
Evidence shows that more than 50% of asylum seekers suffer from post-traumatic stress disorder, depression and anxiety. The Cabrini Asylum Seeker and Refugee Health Hub is one of 3 priority areas of Cabrini's social outreach program. And it's a service that reflects the Cabrini Sisters' missionary vision, a calling to develop new and creative forms of charity that respond swiftly and passionately to the challenges of our time, including the tragedy of so many of our immigrant and refugee brothers and sisters.